The Juvenile Welfare Board and our partners are committed to addressing the complex mental health needs of children, youth, and families in our community. Being aware of the challenges facing our youth and understanding what to look for and how to respond to signs of mental illness in our community is critical. Joining us in studio today to discuss youth mental health first aid training is Vicky Koller, school social worker with Pinellas County Schools. Welcome, Vicky. Thank you for joining us today. And thank you for this little pin here. Can you tell our viewers what the significance is?
Yes, May was Mental Health Awareness Month, and typically when you see someone wearing green or a green ribbon, they're representing mental health awareness.
So Vicky, in light of recent tragedies across the state and country, this type of training is very relevant right now. Can you tell us more?
Yes, mental health first aid there's two types. One is an adult version and one is a youth version. Today you'll probably often hear me say youth mental health first aid and refer to that because that is what I am most familiar with. However, mental health first aid is a curriculum that is meant to teach people risk factors and signs and symptoms of someone that may be displaying mental health disorder, mental health illness, or emotional crisis. It also teaches an action plan on what to do. The youth version in particular teaches typical adolescent development, and that's the difference between mental health first aid versus youth mental health first aid.
Tell us a little bit more about the actual training. What can someone expect when they attend the trainings?
Well, the training is an 8-hour course. It is pretty intensive, but there's a lot of information to cover. The youth version will go over typical adolescent development, really gives you an idea of what you may see in an everyday adolescent day or time, and then what you might see during a non-typical event for an adolescent.
Okay. And the topics, are there certain topics that are covered?
Yes, we do cover some of the more common mental health illnesses that you find in youth, whether it's attention deficit disorder, anxiety disorders, depression. One of the important things to note is that during this training, we don't teach you to diagnose. We don't teach you to provide therapy. This is really a course that is meant to prepare people to feel more comfortable, to have conversations about mental health struggles, as well as knowing what to do in the event that they encounter someone who is developing symptoms.
Okay, and I understand there's a 5-step action plan. Can you expound on that?
Yes. So a lot like, I'd like to kind of provide the analogy that much like heart health has used CPR to teach an action plan, mental health first aid also uses an action plan, an acronym. And that acronym is ALGE. It stands for A, which is the assess for risk of suicide or harm. L is listen non-judgmentally. G is give reassurance and information. The first E is encourage professional help, and the second E is encourage self-help and other strategies.
So prevention and wellness are a critical part of this.
Yes, absolutely. One of the key components to this training is to really fight against stigma. So often in our society, we find people that are afraid to talk about mental illnesses, but more than that, mental illness is often viewed in a negative light, and we forget that there exists mental wellness as well. And so what we try to do with this course is reduce stigma, teach to look for signs and symptoms, but also educate on the fact that there are things that we can do to be mentally healthy, and that mental wellness is a part of us just as much as what we see mental illness being a part of us.
And this is a certification program, is it?
Yes. Again, a lot like CPR this is nationally recognized. So you would take this 8-hour course, and at the end of it, whether you take it in one full day or you take it in 2 4-hour days, you receive a certificate that is nationally recognized. It is good for 3 years, and most persons who take it can then later recertify online or face-to-face if they prefer that as well.
Wow, that's so interesting. It is really mental health CPR.
Yes, it is. I think oftentimes those of us who are instructors or in the world of mental health first aid really refer to the fact that mental health first aid is for mental health, or we're hoping that it will be for mental health what CPR has been for heart health.
Now, is this training only for professionals?
No, it is not. Any person can take the mental health first aid version. Any person who has a youth in their life can take the youth version. It is really meant to be something that prepares people to know what to do until help arrives. So a lot like CPR teaches you in first aid to put pressure on a wound and stop the bleeding until help gets there, a mental health first aid really teaches you how to be a non-judgmental listener and encouraging, and know what to do and who to refer someone to if you have a concern. Wow. So in essence, until the help arrives.
Wow, that's great. That's great. How prevalent is the issue of youth mental health in our county?
Well, unfortunately, Pinellas County has a very high suicide rate, according to Florida Department of Health. We also have a very high prevalence of diagnoses. Now, that's not a horrible thing, and I say that because the sooner that we can address issues, early intervention is key. And so the identification of any disorders or any illnesses that are coming up really influence the ability for someone to recover, for someone to really be healthier. And so although we do have a very high prevalence or high diagnoses noted in Florida Department of Health information, it's also, I think, a positive in that the more we recognize it early on, the more chances we have for recovery. I think often the message out there is, mental illness, when it exists, it doesn't go away. But there are so many things that we can do daily to influence our mental health. A lot like with heart health, you hear things about diet and exercise. In diabetes, the low intake of sugar. With cancer, they say eat antioxidants. Well, with mental health, there are things that we can do every day, practicing relaxation exercises, stress management, really developing a support network of people. For youth in particular, it's very important to have at least one trusted adult that you can talk to. And so this really helps us. I feel like this course is really going to help us as a community to really start being proactive and being mentally healthy.
So JWB is partnering with Pinellas County Schools,
Yes,
and to host these free trainings at our offices. Where else are the trainings offered?
Well, we offer them here in Pinellas County Schools. We're very excited that we were provided a grant from the Substance Abuse and Mental Health Administration to provide youth mental health first aid. And that grant is over, but we've been able to continue teaching our teachers, our bus drivers, any staff member who wishes to attend. We offer them several times throughout the summer as well as after school hours. It's just they can earn trade days for the time that they're there. It also goes towards their teaching certification. But it doesn't stop there. We've also been able to do it for community recreation centers, the YMCA, different community activities and events and trainings that have gone on as well.
Well, this is just a great concept, and Pinellas County Schools and partnering with JWB, we wish you much success and in getting this program going, and all the success to you.
Thank you.
Yeah, thank you so much. Anyone, anywhere can be the one to make a difference in the life of a young person with a mental health challenge if they know what to do and what to say. To learn more about free youth mental health first aid training, contact Vicky Koller or visit jwbpinellas.org/calendar.